change to
Basic
axillary.
pain.
Cephalic vein continues upward and drain into the axillary. There is a communication between cephalic and basidic anterior surface of the elbow that is called medial cubital vein. There is a superficial nervous, a superficial nerve branch or subcutaneous nerve branch that innervate skin. Okay? Lateral half of the arm is innervated by upper lateral cutaneous nerve from axillary nerve and the lower lateral cutaneous nerve from radial nerve. Medial side is innervated by medial cutaneous nerve. Lateral half of the elbow.
Musculocutaneous.
No. Medial cutaneous nerve of arm.
No.
Lateral half of the forearm is innervated by lateral cutaneous nerve of forearm is continuous of musculocutaneous. Medial side is innervated by medial cutaneous nerve of forearm. Palmar surface 3.5 laterally is innervated by medial 1 point medially ulnar. Posterior surface in middle region of the posterior arm is innervated by posterior cutaneous nerve of arm. Middle region of posterior forearm is innervated by middle cutaneous, posterior cutaneous nerve of forearm. Most of them are branches of radial nerve. Posterior surface of the hand 3.5 laterally radial and 1 point medially ulnar. Okay? Dermatum of the upper lip. Dermatum of upper lip. Dermatum, a special area of the skin that is innervated mainly by
Axillary.
spinal nerve. Skin over deltoid muscle is innervated by C4. Lateral side of the arm and forearm, C5. Lateral side of the hand and thumb is innervated by C6. Middle three finger, C7. Little finger and medial side of hand, C8. Medial side of forearm and arm, T1. Armpit, T2. Okay? After it, we studied anterior, posterior, and lateral muscles of the shoulder. This figure, you can see two muscles form anterior muscles of the shoulder from superficial to deep. You can see pectoralis major, pectoralis minor, and subclavius. Pectoralis major origin from sternum, clavicle, and
First costals.
8 upper ribs. All of them is said to lateral
lip
lip
of
of the intertubercular group. Pectoralis minor
the third
origin from
and fifth rib,
5th, 6th, and 7th
ribs and costal
and is said to
carcoid process.
Subclavius origin from first rib and is said to subclavian
Inferior
of the
subclavian.
clavicle. Okay. This one is innervated by
Lateral and medial pectoral
lateral
nerve.
and medial pectoral nerves. This one
Medial.
medial and this one
Subclavian.
subclavian nerve. deltoid muscle. Deltoid muscle origin from clavicle,
clavicular.
acromion, spinal scapula. Insert to deltoid tubercle lateral side of the humerus.
Humerus.
Is innervated by
Axillary.
axillary nerve. Is innervated by axillary nerve. Lower part of the deltoid is important for injection because there is no nerve deep. Posterior muscles. From superficial to deep, you can see
Trapezius.
trapezius and
Latissimus dorsal.
trapezius origin from head,
Up to the
all vertebral of the neck and thorax. All vertebrae. All fibers go laterally and insert into the
scapula.
insertion of the trapezius is origin of the clavicle, acromion, spinal scapula. Okay? This muscle is innervated by
Which muscle? Trapezius.
Directly from the spinal cord?
spine.
Accessory
of
nerve.
accessory nerve. This one is very important. This one is part of accessory nerve. Latissimus dorsi arises from sacrum all
From bottom
lumbar
6,
vertebra,
thoracic.
lower 6 thoracic vertebra and lower angle of the scapula and lower 4 ribs. Lower 4 ribs. These fibers go laterally and insert into the
Floor
Scapula.
of the cerebellum.
floor of the
The
intertubercular
groove.
groove. Floor of the intertubercular groove.
Does it
It's
also-
innervated by
Does it also attach to the scapula inferior angle?
4 ribs, 4 lower ribs.
What about the scapula?
Inferior angle of the scapula.
Oh,
This muscle is innervated by
Thoracodorsal.
thoracodorsal nerve. Thoracodorsal nerve. Okay? In right side, the trapezius is removed. You can see
Rhomboid.
rhomboid muscles. Rhomboid muscles. Rhomboid muscles and levator scapula. All of them origin from spinal cord, cervical and thoracic vertebra. All of them is set to medial side of the
Scapula.
Scapula.
scapula. From above to below, level of
Minor.
the scapula, rhomboid minor and rhomboid major.
Major.
Okay? All of them are related by dorsal scapular nerve. Dorsal scapular nerve. Lateral border of the scapula and
Supra, infra.
the supraspinatus muscle inserted into the
Greater tuberosity.
Greater tuberosity.
infraspinatus inserted to the
Greater tuberosity.
teres minor inserted to the
Greater tuberosity.
Greater tubercle.
and teres major inserted to the
Humerus.
Floor
Inter-
of the
medial
medial
lip
lip of the
humerus.
intertubercular groove.
medial lip of intertubercular groove. Supra and infraspinatus muscle are innervated by
Supraspinous.
supraspinous nerve. Teres minor, lower
Subscap.
axillary nerve, teres major,
Sub-
lower subscapular nerve. Okay? In this figure,
The supra and infraspinatus spinal.
Innervated by the suprascapular nerve.
Do I need to bring
And the teres minor, that axillary.
Supraspinatus
Mm.
muscle.
And teres minor,
Excuse me.
Major.
Hmm?
teres major.
Teres minor.
Lower
Teres
subscapular.
minor insert to greater tubercle. Teres major insert your leaf of the intertubercular groove. Infraglenoid tubercle from infraglenoid tubercle origin long head of triceps. Okay, long head of triceps. You can see triangular and quadrangular space. From quadrangular space pass
Axillary nerve
axillary nerve
and
and
post circumflex artery.
posterior circumflex humeral artery. From triangular
Median
circumflex scapular artery. Circumflex scapular artery pass through it. Okay. What is rotator cuff?
Subra and infraspinatus. Teres and subscapularis. Inferior and superior spinatus. Teres
Four muscles.
minor.
Three of them attached to greater tubercle. Supraspinatus.
Infra, teres minor. Minor and subscapularis.
Other attached to lesser
Lesser.
tubercle is subscapularis. Okay? This muscle protect shoulder joint. For this leg is called rotator cuff. Okay? This muscle.
Serratus anterior.
Serratus anterior. Serratus anterior arises from upper 8 ribs and insert into the medial border of the scapula. Origin from ribs, move backward and insert to medial rib of scapula. This muscle is innervated by
Long thoracic.
long thoracic nerve. Long thoracic nerve. Okay. What is function of this muscle? Protraction of scapula. No shoulder. Protraction of scapula.
If paralyzed, it causes winning.
Yes.
Winning of scapula.
Paralyze, produce
Winging of scapula.
winning of the scapula.
Long thoracic what?
Nerve.
Okay.
Protraction. Function protraction.
Just a bit up.
And now,
Analysis.
little finger.
Where is that? Tira?
Middle ring.
I have it if you want.
Middle ring. Middle index. Flexion. Extension. Abduction. Lateral. Extension.
Abduction.
Adduction. Rotation.
Which muscle involves action?
Deltoid. Middle fiber of deltoid.
Anterior fiber of deltoid. Anterior fibers of deltoid. Pectoralis major. And
Bicep.
coracobrachialis. Coracobrachialis. Extension.
Trapezius.
Posterior fibers of deltoid,
Trapezius.
latissimus dorsi,
Simus.
teres
Teres major.
teres major. Okay? Posterior fiber of deltoid, latissimus dorsi, teres major. This one, first 20 degree, supraspinatus. Medial fiber of deltoid, trapezius. Okay? Supraspinatus, deltoid, trapezius. This one, adduction. All large muscle. Pectoralis, major. Teres, major. Latissimus dorsi, and subscapularis. And subscapularis. This muscle act this function. Medial rotation. Which muscle?
Pectoralis major.
Pectoralis major, subscapularis. Yes. And this function.
Lateral
Lateral
rotation.
rotation. Which muscle? Teres minor, infraspinatus.
Infraspinatus.
Teres minor, infraspinatus. Okay?
Fixed, sir. Okay.
And this figure you can see a schematic figure of
High
the
flexion here.
axillary fossa.
Okay, yeah.
is
Abduction.
supra-
Schematic figure of axillary fossa. The axillary fossa is lateral, medial, posterior, and anterior wall. And apex.
Subclavian artery.
Apex connect the axillary fossa to the neck. This apex is bounded anteriorly by clavicle, medially by first, laterally by
Scapula.
All resin and nerve enter or exit axillary fossa must pass through
Apex of
apex
axillary.
of the axillary fossa. Okay. The walls of the axillary fossa immediately, excuse me, in anterior axillary wall is muscular. Chin muscle complete to formation. Pectoralis major, pectoralis minor, and
Subclavian.
subclavius. Posterior wall is formed by three muscles. Subscapularis, teres major, and latissimus dorsi. Okay. Medial wall is bony and is formed by
Scapula.
four upper ribs and muscle attached to them. Which muscle?
Pectoralis.
Serratus anterior. Serratus anterior. Pectoralis is here. Serratus anterior. Lateral wall is bony. Which one?
Humerus.
Humerus bone. And the muscle attached to it.
Biceps and
Biceps.
brachialis. Sorry. Triceps.
Coracobrachialis. Coracobrachialis. Okay? Medially serratus anterior, laterally coracobrachialis. Content of this fossa. Content of this fossa.
Axillary artery, axillary nerve.
Vein, brachial plexus, and lymph nodes. Okay? At first we need axillary artery. Is continuous of subclavian artery. Enter into the axillary fossa, pass behind pectoralis minor, and descend into the arm after lower border of the teres major is changed to brachial
brachial
artery.
artery.
Okay? Subclavian artery is changed to axillary after first three. Axillary artery changed to brachial artery after
Low
Fair-
border of teres minor.
inferior border of teres major. Axillary artery is divided first line, second line, and third.
Third.
Branches yes,
They're divided into after, before, behind.
yes. Okay, it's fine. First line has one branch, second part has two branch, and third part has three branch. First part, superior thoracic. Second part, lateral thoracic and thoracoacromial. Third part, no thoracic. Third part has no thoracic. They made.
Behind.
Anterior and posterior circumference femoral artery and subscapular artery. Third part of the axillary artery has three branches: anterior circumference, posterior circumference, and subscapularis. This branch, posterior circumference, has a branch of third part. This one, circumflex femoral, circumflex scapular artery, circumflex scapular artery, has a branch of subclavian artery, subscapular artery. Subscapular is a branch of third part. This one is a branch of the subscapularis.
So the before part is superior thoracic and lateral thoracic.
First part, superior thoracic.
And then the second part is,
Lateral thoracic and thoracoacromial.
and then the last part is posterior circumflex and anterior circumflex, and then
subscapular.
subscapularis. That's it.
Subscapular has a important branch that is called circumflex scapula. Subscapular artery has an important branch that is called
Circumflex
circumflex
scapula.
scapula.
Doctor, there are branch of nutrition on the brace, any branch from
No, all artery in the upper and lower limb are anastomosis branch, no any branch. Okay?
This. Before. Behind.
Brachial plexus.
After.
Brachial plexus.
Before. Behind.
Ventral lamina of C5,
This after
C6,
high nerves. High nerves, that's capillaries, no?
C7,
Bella, artery.
C8. Where is
No. Medial.
Excuse me. C5, C6, C7, C8, T1. Continue to formation of cervical plexus. C6, C5 and C6 join together and form
about
superior trunk.
Upper trunk.
Ventral lamina of the
Medial.
C7 form medial trunk. C8 and T1 form
Inferior trunk.
lower trunk or inferior trunk. This part of the plexus is into the cervical region, neck region. Dorsal scapular nerve is a branch of C5. Dorsal scapular nerve innervate which muscles? Levator scapular and rhodopus. Long thoracic nerve is formed by
C5,
C6, C7, and elevate
serratus anterior.
serratus anterior muscle. Okay? Trunks is divided to
Posterior.
anterior and posterior division. The posterior division forms posterior cord. The anterior division of superior and medial canal forms lateral. The anterior division of the inferior canal forms medial. Okay?
This one is the medial.
Anterior division.
No. It is C something.
This part is very important.
Okay. C7 is what?
I think he's gonna draw it now because I didn't understand from can you see it?
Lateral cord, medial cord, and posterior. Lateral cord has two branches, or lateral pectoral nerve,
Lateral head of median nerve,
lateral
height of
head
median nerve,
of median
muscularis nerve,
and
muscularis.
Musculocutaneous. Musculocutaneous, the cutaneous part, elevate cutaneous part, cutaneous part, elevate
Anterior? Lateral.
cutaneous.
Lateral.
Lateral border of the forearm is cutaneous part. Muscular part, elevate
What?
muscular part, EBC. EBC. Biceps, brachialis,
Blunt process.
Okay.
Okay, curious.
The name of the nerve
PPC,
is musculocutaneous. Muscular part
Brachialis.
for this muscle,
For
cutaneous part for lateral half of the forearm nerve. Medial pectoral nerve has
5.
5 branches. Medial pectoral nerve, medial head
Of median
of
nerve,
medial nerve,
median cutaneous of arm,
cutaneous nerve of arm,
medial cutaneous nerve of forearm, ulnar nerve, ulnar.
Medial pectoral nerve innervate
Pectorals.
Minor and major.
major. Lateral pectoral nerve innervate only
The minor.
pectoralis major. Pectoralis is no important. Median and ulnar. Median and ulnar nerve. Which of them innervate skin of the arm? Which of them innervate skin of arm?
Median. Median.
Median and ulnar. Which of
Median.
them?
Median.
Median. This side.
Median.
Right, ulnar. This side.
No. No median and no ulnar.
Radial.
No
Radial.
innervate arm. No skin, no muscles. Okay? Median and ulnar nerve innervate forearm and hand. Don't branch for arm. Median nerve innervate all muscles of the flexor compartment of forearm. All muscles. Except of
Flexor cardiac ulnar, flexor digitum, supinum.
flexor carpi ulnaris and medial part of flexor digitorum profundius. Okay? Palmar muscles. Palmar muscles. All palmar muscles are innervated by.
Medial.
All palmar muscles are innervated by. Ulnar nerve. All muscles, ulnar nerve. Except on abductor, pollicis, brevis, opponents, pollicis, first and second lumbrical and superficial head of flexor pollicis brevis. Okay? What is cutaneous branch of ulnar nerve? Cutaneous branch of ulnar nerve. Ulnar nerve innervate where skin. Medial side of the hand,
And the left
palmar and dorsal surface, and 1.5
of the
medial fingers. Okay?
ring.
Medial nerve innervate
3 and
3.5 lateral
Index.
fingers, lateral
Middle and
fingers,
then half of the
and lateral half of the palmar surface. Okay? Posterior cord has 5 branches. Upper,
دواء subscapula, دواء
nerve, lower, subscapular,
وراء dorsal,
dorsal,
axillary,
axillary,
radial nerve.
and radial. Axillary and radial. Okay? Upper and lower subscapular innervate subscapular muscle. Lower subscapular innervate teres major. Okay? No?
lower, I think, in infraspinal muscle.
Yes, posterior. Teres major. Thoracodorsal innervate
Latissimus
dorsi. Axillary nerve innervate
Armpit.
laterally and teres
There's minor.
minor. Radial nerve innervate
Brachioradialis.
muscle.
Brachioradialis.
Radialis
Radial side of the
muscle. Motor fiber.
Extensor carpi radialis.
Extensor carpi radialis. For memorize best. Okay? Brachio radialis.
Extensor.
All extensor compartment. All muscles of extensor compartment. Arm and forearm. Supinator and triceps. Okay? Sensory innervation of the radial nerve is sensory innervation.
sensory. 1,
3.5 fingers, posterior surface of the hand. And
Doctor, this is finger or this?
lateral. Lateral. And
All the muscles of the
posterior cutaneous nerve of forearm, posterior cutaneous nerve of arm, and
Lateral side.
lower lateral cutaneous nerve of arm. Lower lateral cutaneous nerve of arm. Posterior cutaneous nerve of arm, posterior cutaneous nerve of forearm, lateral 3.5 fingers posteriorly, and lower lateral cutaneous nerve of arm. Okay? Axillary nerve. Which muscle is innervated by axillary nerve?
Biceps.
Deltoid, and
Teres minor.
and
Teres
teres
minor.
and teres
Teres
minor.
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 Teres minor. Teres minor. Excuse. Teres minor. Sensory innervation of axillary nerve. Sensory innervation of axillary nerve. Upper lateral cutaneous nerve of arm. Upper lateral cutaneous nerve of arm. Lower lateral radial, upper lateral axillary. Okay? This is sensory innervation of axillary nerve is upper lateral cutaneous nerve of arm.
Lower lateral is
Lower lateral is a branch of radial.
Then the sensory is just
Skin.
yeah, the skin is just about the axillary nerve and part of the radial nerve.
Axillary nerve, the sensory branch of axillary nerve is upper lateral cutaneous nerve of arm.
Yeah, I know. I mean
Okay, finish. Lower lateral cutaneous nerve of arm. Posterior cutaneous nerve of arm. Posterior cutaneous nerve of forearm. Lateral 3.5 and
yeah, it's branching from the radial
radial.
radial nerve. Then just the radial and the axillary nerve related by the sensory in the arm and the upper limb.
Radial.
Yeah.
axillary. Lower lateral
Okay?
radial. And sensory innervation.
In this figure, you can see why we name course of the brachial braces. This one is
Medial.
medial because it's medial side of axillary artery. This one
Lateral.
lateral cord, and this one
And
Posterior.
posterior.
lymph nodes. The axillary fossa contain three groups, three main groups of lymph node. Lateral group is along axillary vein. Anterior group is in anterior wall of the axillary fossa. For this it is called pectoral group. Posterior group is on posterior wall of axillary fossa. For this it is called subscapular group. Subscapular. All of them drain into the central group, and all of them drain into the apical group. Lymph of the upper limb drain into the lateral group. Lymph of the upper limb drain into the lateral group. What's function of the anterior group? Drain lymph of the breast. What's function of the posterior group?
Drain lymph of the skin back.
Posterior
of this.
posterior part of body part. Okay? All lymph drain into the central and apical lymph node. But lymph of
Fingers.
tongue directly, lymph of tongue directly drain into the apical group. Brachial plexus injury. Brachial plexus injury. When the angle between head and shoulder is increased.
Herbs.
When the angle between head and shoulder is increased, cause
Police.
upper part of the apparatus injury. C5 and C6,
C6.
injury. This injury is called
Policeman given a tip.
palsy. What's the function? What's the
Policeman given a tip.
position of Erb's palsy?
The upper part of the upper lip.
It's adducted.
The shoulder.
How do you can diagnose this palsy?
Forearm is flexed.
This position.
Yeah.
Policeman given a tip.
Yeah.
Receiving.
Policeman.
Ribbing. Receiving a tip.
Upper limb go to abduct and wrist to flexion.
Flexed.
Because abductor muscles and extensor muscles
Are
of the
unopposed.
wrist are polarized.
If you couldn't do this position, that's mean the diagnosis, right?
Policeman,
Yeah.
when take
Yeah.
take me. This position is